The health of Louisiana citizens is in flux, like most of the country. Our residents are experiencing shorter lifespans and bouts of poor mental health episodes. Allison Plyer with the National Conference on Citizenship shed some light on why Louisiana ranks so low. Thank you so much for joining us.
Glad to be here.
So these numbers are pretty shocking whenever you look at them at first. So let's start with the life expectancy. So Louisiana has the third shortest life expectancy among Americans.
Right.
Why is that?
Well, it's particularly bad news because obviously life expectancy in the U.S. fell in the first year of COVID. And unlike other developed countries who were able to turn that around and increase their life expectancy the second year, ours continued to fall. And Louisiana is, as you said, the third lowest life expectancy. There's a number of things that came along with COVID in addition to 18,000 people dying in Louisiana from COVID. We've seen drug overdoses skyrocket by 30%, and Louisiana has a higher than average rate of drug overdose deaths now. Also, gun suicides, which are the majority of ways that guns actually cause death, are suicides, sadly. And Louisiana also is higher than the national average, and those skyrocketed about 10%. We've also seen increased traffic fatalities. So there's, obviously the mental health issues that you mentioned are a big component of these increasing deaths.
Right. And I mean, you would think, 3 years after the pandemic, we would see some sort of improvement. But I'm looking at the mental health numbers and it says 40% of Louisianians report symptoms of anxiety or depression. I mean, why are we not seeing any of those improvements?
Yeah, and that was as recently as December of 2022, right? So just a couple months ago. And that's only among adults. And obviously there's mental health issues that teenagers and young people are experiencing as well. Louisiana has had some of the most severe, of course, disasters in the last 3 years, which have compounded the stress of the COVID crises, right? Louisiana parishes, every single one has had at least 12 disaster declarations in the same time frame that we've had COVID going on. So that causes a lot of anxiety and depression. And then we've had power outages. We've had, more hours of power outages across the state than any other state in the nation over the last 10 years. So, if our infrastructure were more resilient, and we could be more resilient in the face of these disasters, that would help a lot.
And then, of course, there's long COVID.
That's right, yeah. And currently, 31% of Louisianans who have experienced COVID say they're experiencing long COVID, which can be really debilitating. For some folks, it means they just can't even go to work. So nationwide, long COVID is going to continue to be an issue, and doctors are saying there's not enough research about how to treat it, which is a problem, right? If doctors don't know how to help you get better, then these are symptoms that people can really struggle with for a long time.
Now, you're a researcher, which means you look at data like this all the time. Have you ever seen, ranks and scores this low before?
Well, sadly, Louisiana often ranks very low in the nation. But I think what's really concerning is that the nation is ranking so low in many of these. Life expectancy has not turned around in the last year and a half as it has for other wealthy countries. The thing about gun suicides, for example, is about 3 times as high in the U.S. as it is in other countries. Also, pregnancy-related deaths in the U.S. are twice as high as they are in other wealthy countries. And in Louisiana, they're 3 times as high as they are in the U.S., right? So Louisiana often is at the bottom of rankings, but the U.S. itself is not doing well on health measures compared to other wealthy nations.
Do you see this improving anytime soon? I mean, it's been nearly 3 years, almost, since the pandemic hit and we went on lockdown. But these numbers have been lingering and it seems like they've been getting worse. I mean, do you see this improving anytime soon?
Yeah, I think there's a lot of sort of opportunities and challenges ahead, right? Speaking of infrastructure, we know there's a lot of funding coming from the federal government to strengthen infrastructure, and that'll be going over probably a decade. The state can do a lot to improve health and mental health. One thing we know is that states that don't have paid sick leave, that there are more people because of the stress of not being able to take off work and be paid, actually have mental health crises, there's more gun suicide, more overdose deaths. And so states can actually help by saying, hey, we need to have paid sick leave, or at least let localities pass ordinances to require paid sick leave in their jurisdictions.
All right, so is there anything else about the study that stuck out to you? Anything that people should know?
I think that, the next many years are going to be really important ones for building the health of our communities, right? To come out of this. In order to be productive citizens, we also need to be healthy. And so the state will need to spend some time focusing on that going forward.
Well, thank you so much for joining us this evening. We appreciate having you in.
Thank you.